All right, Lisa, it's time for a little quiz. We've all heard of high blood pressure, but do you really know what blood pressure is?
Well, Sean, I know it has something to do with how the blood travels through the body.
Yeah, and for the most part, you're right, but there's a little more to it. You can see it here on this graph. According to the Centers for Disease Control and Prevention, blood pressure is the force of blood against your artery walls as it goes through the body. Naturally, your blood pressure goes up and down throughout the day. Now here's a little nugget that most people do know. If your blood pressure stays high, it can cause some serious health concerns.
Health problems like heart disease and stroke. Unfortunately, many people are at risk because of high blood pressure. The CDC reports 70 million adults have high blood pressure. That's 29% of adults, or 1 in 3. But it's not just adults. The CDC says children can also develop high blood pressure. So you hear all this, you may be wondering, where should my numbers be?
Well, first you must understand that blood pressure is recorded as 2 numbers. According to the American Heart Association, the top number, or systolic number, measures the pressure in your arteries when your heart beats. The association says the bottom number, or diastolic number, measures the pressure in your arteries between heartbeats.
And take a look at this graphic from the American Heart Association. This gives you an idea of where your number should be. You can see a normal reading in the green is a top number of less than 120 and a bottom number less than 80. Now, if you're higher than that, that's where it gets dangerous. You can see the difference in numbers, which determines if you have stage 1 or stage 2 high blood pressure. And then in the dark red, you can see there's also something called hypertensive crisis if you're higher than 180 over 110. That's not somewhere anybody wants to be.
No, and that's why experts say you should be proactive treating high blood pressure. And now a new study suggests that a new approach in treating the condition may very well make a world of difference.
Alan Brickman always had normal blood pressure, but then a few years ago, just after their 10th anniversary, his wife suddenly died of a stroke. She was only 54.
It was a difficult year.
The emotional pain caused his blood pressure to climb, so his doctor told him to join a national blood pressure study. The groundbreaking study changed the course of his health and his future.
It's been tremendous for me. I mean, my blood pressure in my latest series of studies was well under 120.
The results of that study now has the medical community rethinking the optimum blood pressure for people 50 and over, instead of 140 as the top number. The study finds that with a number of 120 or lower, your risk of dying from a heart attack, heart failure, and stroke is greatly reduced.
I think in time we will see more intensification of medications to get to lower blood pressure goals for many patients. Maybe not all, but for many patients.
In the past, there was concern about blood pressure medication side effects, like getting dizzy or lightheaded when you stood up too fast, depression, or erectile dysfunction in men.
Sexual dysfunction in men is a very important issue and not well discussed, but it's a real factor with patients adhering to their medication regimen.
But lowering blood pressure is so important, doctors can help by changing prescriptions or dose.
Yes, definitely. We have many choices of medication. Some medication would not cause this problem.
You can also lower your blood pressure by changing your lifestyle. For instance, keep a normal weight and exercise. Stop smoking. Drink less alcohol and cut out the extra salt in your diet, which tends to be high in packaged, processed, and fast foods. And of course, avoid skipping your blood pressure medication.
Yeah, very important. Now, there's another reason you'll want to manage your blood pressure. We've already mentioned high blood pressure increases your risk of heart disease and stroke, but migraines as well. Some medical experts say the relation between the two is mostly related to stress, and when you pair them together, the results can be downright debilitating. So let's talk treatment. It may come as no surprise then that beta blockers, which are commonly used to treat high blood pressure, are often used to prevent migraines. But just recently, a medical breakthrough, and it could provide the relief that millions of migraine sufferers so desperately want.
Take a look at the
This is 29-year-old Kathy Periandri. In a follow-up visit to the doctor, she says gave her back her life.
As soon as he did it, I could feel the pressure just release.
She's talking about the pressure that would give her up to 15 migraine headaches a month.
It was slowing down my motor skills, my cognitive skills. I would get them and I would just start throwing up. I would pass out from the pain. Nothing was working for it.
Then she heard about a possible surgical solution developed by Dr. Ba Magairon. She would be the perfect candidate with the pain coming from all of the so-called main trigger points.
Right in this area here.
Okay, can you let your finger go?
With a special Doppler device, he can pinpoint the origins of the headache. With this woman, even a day after hers was at its worst.
Like in the forehead, frowning muscles can irritate the nerves. In the back of the head, there are muscles and vessels that can irritate the nerves.
And as the CT scan shows, the pain source can even be in the nose, especially with a deviated septum. So the surgery is a matter of small incisions where he goes in and removes anything rubbing against the trigger point nerves. For Kathy, it would be every trigger point. One surgery at a time, she says, brought relief, but it would take 4 total to get her migraine free.
Did you ever think you would be?
No.
The procedure is not a guaranteed fix, but Dr. Guyron says 90% of the time, if it doesn't bring total relief, there is at least some.
It has been an enormously rewarding discovery for me because day after day, the patients tell me that their lives have been changed.
The surgery is an outpatient procedure. Patients are usually sedated or undergo general anesthesia. It takes about 45 minutes to an hour for each trigger point to be deactivated. And Sean, I don't get chronic migraines, but I think if I did, that procedure would be well worth it.
Well, it sounds like it to me. And there are many other treatments for migraines that are showing some promise. We've talked about nerve stimulation before. Doctors stimulate nerves where the headaches start in the base of the skull near the spinal cord. There's also the FDA-approved high-tech headband, Cephaly. This battery-powered plastic headband that stimulates nerves beneath the forehead that trigger migraine headaches. In fact, the headband may actually prevent them.
Another preventative measure, a new class of drugs called CGRP monoclonal antibodies. They work by reducing the peptide in the body that drives migraine pain. It may take years for the monthly injection to be available, but it's already being called a landmark development. And of course, there's Botox for treating migraines. The FDA approved use of Botox for chronic migraines about 5 years ago.
So what classifies as chronic pain? Well, the criteria that must be met sound absolutely debilitating.
In order to be diagnosed with chronic migraine, a person needs to have headaches on at least 15 days per month or more, and with headaches lasting more than 4 hours each day, and if untreated, and with at least 8 of those headaches with migraine features. So you don't have to have migraines on all 15 days, but only on 8 days.
Experts say chronic migraines can really interrupt your life, affecting everything from your work to your sleep. If you have any questions about headaches or migraines, including what treatment options may be best for you, it's best to speak with your doctor.
Absolutely. And something impacting children that is often much more complicated to treat, childhood cancers. Coming up next, how an 11-year-old girl has managed to beat the odds with one of the rarest forms of cancer out there, all with a big smile on her face.
And what do you think about cancer-sniffing dogs? Coming up, learn how Fifi and Fido could really help in the fight against these tragic childhood cancers.
And many young people enjoy the company of the family dog or cat. Hey, many adults do as well. Still ahead, we introduce you to a few sweet animals who could become a part of your family. Delmarva Life, we'll be right back.